Alrighty, ladies and gentlemen, it is Friday. It is the best day of the week all the time, every time. I mean, if Friday wasn't the best day of the week, Monday definitely would not be it. All right, so today's episode, we got Cypress Health and Wellness in out of Youngsville, the nurse practitioners, Jaimie, Melancon, and Kimberly Chu. Okay, got it. We're going to be talking about, of course, health and wellness. We're going to be talking about how they started the business, what got them into the medical field, because that is a big business in the Acadiana area and all that good stuff. We're going to be talking about eating habits because I think they might have some input on that, especially in South Louisiana. But anyway, yeah, you're listening to the tea. Alrighty, so first off, I want to go ahead and get you guys introduced. We kind of briefly done it just a second ago, but I'm gonna let you guys kind of give a short, like 20-second spill about who you guys are and like kind of where you come from. If you're not from here, what got you to Lafayette? Melancon, I think you're from this area.
Yes.
And then Kimberly, you might be born and raised here, but we'll get there. So go ahead and Jaimie, if you want to go ahead and introduce yourself, let people know who you are.
Yeah, I'm actually a double Cajun. I was a Vincent before I got married.
Oh,
Melancon
wow.
was my married name. So yes, I grew up in Lafayette. Went to Lafayette High and went to UL for my bachelor's for my nursing degree, and then we went back to UL together for our MP degrees. And I live in Lafayette with my husband and my little girl. My family's from here, so born and raised.
Awesome, awesome. And Kimberly?
Same thing pretty much. So I graduated from Lafayette High School and I went to UL for my bachelor's in science nursing degree, and then again for my master's. That's when Jaimie and I graduated the same year, and I'm actually married now, so I'm a Guidry.
You're a Guidry?
I'm a Guidry.
Wait, is it Kimberly Chu Guidry?
Yes.
Okay.
Yeah. It hasn't been officially completely changed. We've only been married for 2 months.
Yeah, she just got married.
There you go. Awesome. Congratulations on that, by the way.
Thank you.
And you live in Lafayette or Youngsville?
Well, we live in Lafayette.
You both live in Lafayette? Okay.
Yes, sir.
So that brings me straight to the question of why did you guys want to open up a practice in Youngsville? Like, you guys are in Lafayette, but why Youngsville?
So we saw a need in the Youngsville area. It's growing at a rapid rate, and there aren't a lot of primary care providers there. We both were ER background nurse practitioners, nurses as well. And then we both worked in urgent cares. And so we have a lot of experience in various areas. But we decided it was time to do primary care. We had talked about it since we were in school, and then started really talking about it about a year and a half ago, maybe a little longer.
Yeah.
And we looked around and saw Youngsville needed more help. And they only had about 3 primary care offices there, and there's so many neighborhoods going up. Right. They needed some more primary care providers. So we thought we could fit that bill.
Yeah, because there's plenty in Lafayette.
Yeah, super saturated.
Lafayette proper, I guess you'd say. Saturated. And, I mean, to try to penetrate that market is already hard enough for even restaurants. I mean, restaurants, medical, I mean, those two things are growing. it feels like almost on an equal pace.
Yeah.
Like for every doctor practice, there's a restaurant opening up.
Almost. Funny you say that, though. They still have a lot of patients in Lafayette who don't have a primary care provider. Some of the underinsured or cash patients, they like when my father-in-law was trying to get into his primary care, he got hospitalized about 2 years ago, and he called and called and called, and there was multiple month waits at multiple different places that took his insurance, and he was insured. And he found one, but after about 10 or 15 places. So there are still a lot of people in Lafayette, even though that's so saturated, that you can't get in. So we have some patients that come from Lafayette. We have some patients that come from New Iberia, patients from Karen Crow.
So it's funny that you say a lot of people don't have a primary care provider. I'm one of those people. I don't have a
Well, we can get you in.
Well,
I know
look,
somebody.
I've been thinking about it. Look, let's just be honest here. Having to go to the doctor or having to think about booking an appointment with a physician or a nurse practitioner, it's a little daunting, because it's like you're gonna have to reveal every potential thing and have things told to you that you may not want to hear.
Yeah.
That's partly.
Well, can I give you an example? So
Sure.
my husband, he's going to be so upset that I revealed this. He is 3 years.
Is this
younger
going
than me.
against HIPAA?
No, he consents.
Okay. All right.
But if we didn't find out that he had elevated cholesterol levels, they were like through the roof. You know, elevated cholesterol, triglycerides can also lead to heart attack and stroke, right? So even though he's young, he can. Those are major risk factors. So we definitely want to prevent, him ever having that event. So that's why, when we found out, we put him on not blood pressure medication, cholesterol medication to help lower that and reduce those risk factors, so he doesn't develop like a heart attack or stroke at 35.
Oh, okay. Scary, because I'm 36, and look, last time I had my cholesterol checked, I was probably 23 or 24, and it was fine then. I'm scared to know if it's still fine or not.
We have had so many patients, younger and younger, having heart disease, high blood pressure, high cholesterol in their 20s, 30s. When we were younger in nursing school and first in nursing, we were seeing that in 40, 50, 60-year-olds. Now I have multiple 20-year-olds on blood pressure medication. We want to really focus in our practice on more preventative maintenance, but because a lot of people don't know that they should be going just for their wellness exam, just to know where I'm at, where do I stand, where could I be doing better, so we can catch those things early, like she was talking about with her husband. If we can get people in their 20s, 30s coming in and giving them things that they can be doing to prevent those things, they can live longer without being on medication. And some people, we can get off of their medication if we can make those changes, if it's not too late.
Oh man. Okay. Before we get to,
we're gonna make an appointment for next week.
Right. God, look, and I've never had a wellness check, and since I've had my own insurance, I started. I remember getting on. I used to work at golfballs.com, and I got my insurance plan there, and they said, "Hey, you have like 1 year every year you have a wellness check, and it's free." I'm like,
correct.
"Cool, I'm gonna go do that." And it's been 10 years since that thought, and I've never done it. I'm like, I probably need to do this. And
that's what drives me crazy, because people pay all this money for insurance, and the couple free things they could be getting, it's just an afterthought.
Yeah.
Come get your free stuff.
I know. And look, everybody loves free stuff. It's like, why not use it? We have a couple of comments already, which is cool. So
can I just comment that
sure.
with our wellness exams, we check your CBC, which is your blood count, make sure you're not anemic or anything like that, your electrolytes, your kidney functions, your liver functions. We also check thyroid functions, as well as a lipid panel, your cholesterol, triglycerides, and good cholesterol. I check vitamin D on everyone, because everyone's pretty much vitamin D deficient. And when you are deficient, that can lead to depression,
Bone issues. It can lead. It's very important in a lot of different functions in the body.
So should we spend more time in the sun?
Yes, but you can get it from foods too. But you have to spend. We all think about it. Back in the day, people worked outside.
Yeah.
Now we all work in offices.
I know,
with
we're all
no
pale.
windows. Yeah. Even I have some people who even are super tan and go outside all the time. They work outside and their vitamin D is low. It's just maybe they're not absorbing it for whatever reason. You have to be exposed. So if they're wearing long sleeve shirts or pants, it's not getting absorbed. And we do all the blood work in the office, so you don't have to leave to go get your labs at another place.
Okay.
We draw it there. So
Awesome.
even more convenient, one-stop shop.
Yeah, and so the takeaway there is get more exposed
To vitamin D.
to vitamin
Not
D.
COVID.
Yes. Okay. Definitely not COVID. I'm talking about
Please.
exposed to the sun. Okay.
But if you have COVID, we can also do COVID testing at our facilities.
Well, that's good to know.
Yeah, we do COVID testing, flu testing, strep testing as well.
All right, so we got a comment. Amazing primary care providers. They really care about your entire health and not just about pushing prescriptions.
Yeah,
So you guys are not just drug pushers.
No,
Apparently.
we're trying to
Awesome.
get you off your medicine.
Right.
Yeah, nobody wants to be on medication.
No.
Right.
And then, oh God,
Oh gosh.
Brittany, who commented, she's a she works at Manual Commercial,
Hey,
and
Brittany.
she's also a sponsor of Developing Lafayette, and the Manual Commercial is, and she goes, better schedule that appointment, Ben. I'm like, God, look, I don't need to be
knows.
called out.
Get him, Brittany.
All right, and then we literally just got another comment. Is it Brittany again? Yes. They are awesome. Jaimie improved my health. Awesome. Well, that's good to know. That's a good referral there, or a testimony, in a sense. All right. So going back to preventative care and all that good stuff, when somebody comes in to get like a wellness check, and let's say they're in Louisiana, most of it is heart related or cholesterol, because the food that we have here, it just
Terrible.
So good.
It's delicious.
It's terrible
bad.
and it's amazing at the
Yes.
same time. It's a double-edged sword. You just have to kind of fall on it. All right. So what do you guys suggest to them? Let's say they have some heart stuff developing and they can catch it early. Do you tell them to cut out boudin altogether, or is the whole everything's good in moderation still good?
Yeah. So, you want to speak? Or you want me to? Okay. I it's not realistic to tell people in this area to cut that out.
Right.
I mean,
You'll get some looks.
Yes. So, I mean, we have to meet our patients in the middle. We involve our patients in every plan we make with them. So if they say, hey, I'm suggesting something, and they're like, that's not going to happen. Okay, well, where can we meet in the middle to try to get you better? But also, you have to live your life. So, boudin, yes. Boudin every day? No. So, everything in moderation. I mean, we could get into a very long conversation about diet. There's foods that we eat, not just the fatty foods, but inflammatory foods like sugars, wheat, gluten, dairy,
all the good
all
stuff.
the good stuff.
God.
That's terrible and very, very hard to take out of your diet. So what I tell most patients is you can have those things maybe 2-3 times a week, and definitely not together in one meal multiple times a day. And I know it's hard. It is hard. And not everybody's sensitive to those things, but especially if somebody's coming to us with GI issues or persistent rashes or allergies, a lot of things come from the foods we eat. There's even hormone issues from the foods we eat. So diet is a big thing we talk about with most of our patients. We do weight loss, so that's a big thing we talk about with our patients. So moderation, we have to be realistic here. So people have to be able to have that cake, but not every day.
Yeah.
I have
Maybe
people
once a
coming
month.
in, they're eating ice cream every night. No.
Yeah.
Every night.
Every night,
Look,
yeah.
I love ice cream, and look, when I was younger, I could eat it multiple times a week. Now,
Me too.
and look, like cookies and cream. I mean, a Butterfinger blast from Sonic gets me.
Yeah.
And so my little boy, he's 5 going on 6. After school on Fridays, if he gets a good conduct throughout the week, we'll go have a ice cream Friday.
Yeah.
And like we get the mini now because I don't get it because I'm trying to watch my diet per se. I get it because I'm trying to watch my money diet, my wallet. And Sonic's little mini things are not cheap. They're like over $3. I'm like, gosh, Bennett. Like we need to find somewhere like better. I tried to bring them to like McDonald's to get a McFlurry, but those are not any cheaper either. Everything's getting expensive and it's not any healthier, but whatever. It's still good. Like
my newly diagnosed diabetes patients, sometimes my diabetic patients, they're like, oh, I eat ice cream every single day. It's my favorite food. And I'm like, well, it's not good for your blood sugar.
Is that why you have diabetes?
Yeah. And what about sugar-free? Let's talk about some sugar-free options. They don't taste the same. I understand that. But I'm like, well, in order to get you to a better level, we have to cut this out for now.
Yeah.
And it's just temporary, hopefully, until we do a lot of lifestyle modifications. Exercise definitely helps increase insulin in the pancreas as well to help with diabetes.
You bring up an interesting point. I was on, now look, what I'm about to say is you don't take this as medical advice or a solution or a area where you get your medical advice. But I was on TikTok the other day.
Oh boy!
I know. I know the thoughts. I feel them.
It's okay.
But I want to say I use a term that my pastor sometimes uses. I was pricked in my heart about something somebody was saying. I'm like, dude, I'm like freaking out. This guy was like, look. Let's talk about what the real pandemic is. It is diabetes, pre-diabetes, I think he stated. He said, what most people don't realize is that you could be suffering from it and not even know it.
Yeah.
And he listed off a few like general like things that you may have or you may notice if you are pre-diabetic. One of those things is a gut. And I'm like, oh God, I have a gut. And then he says, having trouble sleeping at night. You don't work out, or you're relatively sedentary for the most part. And then there was another thing. I don't know. Just he listed off a few things. I'm like, not every one of those things I felt like I had. Like I feel like I sleep decent at night, but being in my later 30s now, I feel like I'm tired later on during the day. I'm like, I don't know if I slept bad or if it's just me being over 30. And so I was like, you know what? And it like right then and there, I started doing like sit-ups and like, cause he mentioned, he said working out helps produce insulin or helps like fight the sugar. He said,
insulin resistance.
And he said, you got to use weight resistance or some type of resistance training to help you, because if you don't, you're going to go down a path that you just don't want to go down. And I'm sitting there like, oh my God, this is scary. So I literally started doing push-ups. And he said, start doing push-ups, start doing stuff to like, you don't have to go out, get an expensive gym membership. You literally can just push up your own weight, because not very many people can even do that. So I started doing that, and I felt better. And I've worked out before at a gym, and I felt great. But yeah, just that like there freaked me out. So it has me wanting to potentially do a wellness check pretty soon. And if you say I can get in there in a week, gosh, doc, all right.
Well, I mean, overweight and obesity can lead to sleep apnea, can cause sleep apnea.
Yep.
What happens when you have sleep apnea? You don't sleep well.
Yep.
You snore. Your significant other probably hates you. So, of course, high cholesterol, it could make you pre-diabetic, lead to heart disease. I mean, there's a lot of negatives when it comes to being overweight and obese. So just, having a better lifestyle, better food choices, it also makes you feel better too when you make those lifestyle changes. So.
Yeah. So I don't know if I can develop a routine like some people can, where they get up at 5 a.m. and go jog. But I think I definitely need to. I loved working out. It's just the pandemic happened. I had a gym membership during the pandemic, or right at the beginning of the pandemic, and then I was like 2.5 months in to the gym membership, and the pandemic happened. I'm like, well, I'm not going to the gym, and I think it even closed for that year. And then I refused to go back for a while, because it's like I've been in gyms enough to where I have to clean my own machines, and I can't trust anybody else cleaning their machines. So But yeah, so we have another comment. Okay. Jesse Melancon.
Okay.
Oh, hey, babe. That's my husband.
Well, let me go ahead and read his comment. All right. So Jesse says, can't recommend the clinic enough. They take the time to really listen and including their patients in their health plans and goals. Okay. They're good. Very good. And that was your husband, you said?
Yeah, but he
Nice.
is a patient of our clinic. So.
Oh, look, again.
He said it. So.
My husband's working today, so I don't think he has time.
That's all right. Okay. So we're going to talk a little bit about kind of like why you guys wanted to go into the medical field. Like, was that something that you guys always want to do out of high school? Or is it just kind of like you had a point in your life where like, I need to figure out what my path is?
So mine was very personable, actually.
Okay.
So I actually had a sister who was ill. She had lupus, which is an autoimmune disease. Lupus can broad from mild to severe. She was on the severe spectrum. She had heart failure. She had kidney failure. She was on dialysis. And I mean, you know, bless.
Yeah.
God bless her. But she passed away at 27. So I get emotional when I talk about that. Sorry. But that drove me to want to be in medicine.
Okay.
To help people like her. So.
That's good. That's good. Hey, and
Sorry, I get emotional when I talk about her.
It's totally fine. Look, hey, I've cried, or I say cried. I've teared up on my own podcast before because I too lost a baby. I lost a 22-week-old baby. Of course, it was a miscarriage or stillbirth technically, because it was at 22 weeks, and I think it goes from miscarriage to stillbirth. But so, yeah, I was talking about that and I started bawling. I'm like, gosh, I can't be doing this.
Yeah.
But yeah, what about you, Jaimie? Did you have families that were doctors?
My sister was in nursing school and I kind of followed. I was like, yeah, I think I could do that. I actually wanted to be a lawyer in middle school.
Oh.
And I was like, I don't think I can argue for the rest of my life.
But you probably do anyway,
but
right?
I do, yeah. I mean, and I probably could. My husband would say that. But, and I saw that she enjoyed nursing, and so I kind of followed that. And when I got in through school and started nursing, there's so many different opportunities as a nurse that you can, if you don't like hospital, you can do clinic. If you don't like clinic, you can do wound care. You can do home health. You can be an educator. There's so many opportunities. There's always going to be a job. You can help so many different people.
Right.
So
you could also travel nurse because I did that for a little bit. I actually worked in the Virgin Islands, Las Vegas, and Long Beach, California for about a year and a half, and I had the best time of my life.
Yeah.
So before I went back for my nurse practitioner.
So there's tons of opportunities.
Yeah.
So.
All right. Well, I have a couple of sponsors that I'm going to mention real quick. You probably have seen them on the screen if you're watching. So the Music Academy of Acadiana, they're Acadiana's top choice for music lessons. So if you want to be educated in music and if you want to learn something, an instrument, they teach piano, guitar, voice, drums, violin, saxophone, all those fun things. It's founded locally by Tim Benson, who is a UL Lafayette Music School graduate. And they teach students of all ages and styles. They've had appearances on American Idol and The Voice, which is really cool. And they've won multiple local and national awards throughout their existence, which I think it's been a little over 10 years maybe. And Tim, he's a technical musician as well. He was in a rock band, and that was kind of cool. You can actually find some of their music on YouTube. I think I don't know if the song or the band was Liquid Sand or something like that. I don't know. I have to go back and look to make sure, but he might chime in if he's listening. Anyway, check them out. Their goals is to make music lessons fun, educational, and to help foster the next generation of musicians and creative thinkers. And you can check them out at musicacademyacadiana.com. And then, of course, Facebook, Instagram. And then we have The Orchard, who is Acadiana's only Apple authorized service provider. So if you have a broken screen, and like I said on the last episode, most of you guys do have a broken screen. I have a broken screen protector, so I'm close to having a broken screen. I know, I just need to get a new one. But The Orchard can help fix your device. So if you do have a broken one, if it's a MacBook, all those things are super expensive to repair. And if you use a third party other than an Apple authorized provider, you may have issues further down the road with sticky keyboards or screens that ultimately fail. So check them out. Their website's theorchardstores.com, and they have 2 locations in Lafayette, one on Ambassador by Buffalo Wild Wings and in Carencro by Super One Foods. And so we really appreciate our sponsors, and back to medical talk. All right. So we were just talking about how you guys got started in medical, and you mentioned that you were a travel nurse, and I find that interesting because, like, I've heard of travel nurses. What makes someone want to do travel nursing?
Oh, let me tell you.
Yeah, go ahead and tell me.
So it's pretty much someone else is paying for your mini vacation while you get to work at a different facility. And then with travel nursing, they pay you a little bit more than staff nurses get paid in this community, especially in California, New York, the big cities. So it makes it really enticing. So you can go make your money and be a tourist and do all these fun things at someone else's expense.
Wow. So why'd you stop?
Because I wanted to come back to Lafayette, Louisiana, because this is where I grew up and this is my hometown, and there's no place like home. Okay, I always had a house here. I did. Now I'm married, so
There you go.
I had to sell my house. But why I stopped, because I wanted to go back to become a nurse practitioner and to help people in a different way.
Okay.
Yeah,
And you wanted to be obviously a business owner and not working for someone else's.
Yes.
Okay.
Yes. For
Kind
sure.
of. Yeah.
Yeah. Well, I mean, this is more of a newer venture.
Yeah.
So, yeah, it's a little scary being a business owner, but exciting at the same time, because you can, of course, make your own decisions and rules and.
Yeah. You can definitely make your own decisions, but your own decisions can also affect how much money you end up making.
Yes.
True.
I realized that one
Can't do the
firsthand.
family friends discount all the time.
Right. I know. And that's always being a thing that's asked for. All right. So I want to, you guys sent me a few talking points, and just to kind of help the conversation go in the right direction. And one of the things that you and I, Kim, have talked about before whenever we wrote about you guys was the differences between a nurse practitioner and, for example, a physician or something like that, and what terms of care you guys can provide, and why should people choose to use a nurse practitioner over another primary care office? Like, what are the benefits that they're getting and what are the I guess the things that they're not getting that they could get, I guess, elsewhere, or if anything. From what I understand, you can get just about everything you need because you guys worked at urgent cares. Most people use urgent cares almost exclusively now.
I know.
So
yes.
what are those differences?
So, of course, nurse practitioners are able to assess, evaluate, diagnose, treat, order imaging, order labs, like physicians do. There hasn't been a lot of primary care physicians in this area. Most physicians go into a specialty nowadays because it's better for them, I guess.
Mucho dinero.
Yeah.
And so that's where nurse practitioners come in. We come in to help bridge that area, that gap when there's a lack of primary care providers.
Okay.
Pretty much. Does that make sense, Ben?
Yeah, that makes sense. I mean, enough to
and it's
understand.
It's also like personality provider dependent. You might, get along with, with me and not get along with Jaimie, or vice versa. It's just provider dependent as well.
Yeah. And so you guys can administer like injections and all that good stuff.
Yes.
You just can't use a scalpel, right? Or can you use a scalpel? I don't know.
We can use a scalpel, and we do I&D abscesses and stuff. We don't go to surgery.
Right.
But there are a lot of nurse practitioners who work with
Physicians.
orthopedists, surgeons, all the specialists, and they do go to surgery. They get their first assist. They go to surgery with the physician.
Which is a different certification.
Okay.
Yeah.
So there are
have
a
to be
lot of nurse
certified.
practitioners.
There's layers. There's a lot of layers.
I mean, we're in the hospital. We do admission work. So if you're in the hospital, you may see a nurse practitioner instead of the doctor. You may see both. All the specialists pretty much now have their right-hand man or woman, nurse practitioner or PA. So we're all over the place. Like I said, we still work in the ER right now.
So you
we
might
still
see Jaimie and I one day. Like,
Yeah.
I thought I saw you at Cypress Health and Wellness. Oh, yeah, we do that too.
Wow. So how do y'all have the time? Like, do y'all have to y'all take shifts?
Yeah.
Okay, there you go.
So we're just starting out business. So we're in the clinic together on some days, and then some days we're there individually. And so we'll pick up shifts at other places to kind of bridge the gap. So.
Yeah. You'll probably see me working at the hospital. I'm not going to name which one, but I'll probably admit you one day. I'm like, hi.
Well, or she might see you on the floor because she does that too.
Yeah.
Oh yeah. Look, nobody wants to ever think about being admitted. That's a scary thought.
Yeah.
I'll only admit you if you need it. I promise.
Another thing to answer your question a little further about what makes not just us different from the physicians, but our practice different from other primary care practices is we try to schedule our patients in an appropriate time slot so that we give them more attention. A lot of primary care offices, and I'm not trying to diss anybody, but they schedule, because they have so many patients, they're so overwhelmed because there's such a need to get people in, they schedule 10, 15-minute slots. And you got to be in and out in 15 minutes, see your next patient.
We're not a 15-minute, 10-minute oil change facility.
So we'll
try take our time.
We try to do more like 30, 45-minute, hour slots while we're not packed right now.
Yeah.
So that we can get to know the patients, make sure that all their needs are met.
Their concerns are addressed.
Right. We can educate them appropriately, because I have a lot of patients who come in who were known diabetics for years and years and never were taught that they can't eat a ton of fruit because it has sugar in it. They didn't know that they could.
Well, fruit's supposed to be good for you.
Yeah, but if you're diabetic, it has sugar in it, so you have to limit that. They didn't know. They're not educated on diabetes diet education, so we are able to kind of bridge that in the meantime.
Okay. Yeah, so that is great. Look, I'm now that I'm speaking to you guys more and more, like I'm like further convincing myself. I still have the thought in the back of my head, like I need to go
next week, Ben.
God.
The white coat syndrome is a real thing.
My husband has white coat
syndrome. Husband too.
Mm-hmm.
They come in, they sit down, their blood pressures are like
sky
high
elevated.
because they're nervous. But I mean, we're real people too, and we're gonna meet you in the middle.
Like y'all have y'all's white coats on right now. Like I feel like my arm is like tensing up because I feel like I'm about to get an injection in my arm. I'm like, what's about to happen?
We would never do it without your consent.
Obviously that should be the normal thing, right? Okay, so what is the primary, like, I guess, demographic type of people that you guys see? Or obviously you want to see anybody and everybody, but like at the moment, like what are you guys seeing the most come in?
So, I mean, at this time, we're seeing age 18 and above for wellness and other issues if they have
Health maintenance.
But we can also see sick patients, sick care. So we'll see 6 months and above for that.
Okay,
population.
so like young, like babies.
Yeah.
Okay. Yeah. Wow. But you guys, obviously pediatricians are different in that respect. But this is urgent care style things.
We're like
right?
walk-in sick care. We're not like urgent care. I don't want to label us like that at all. Yeah.
Okay.
Because we're going to take our time still.
Yeah, we want the people under 18 to kind of keep their pediatrician, because they do a lot of, not that we're not skilled in that, but we want to focus more of our demographic on adults for the health maintenance, wellness, and all that. So the pediatric demographic can keep their pediatrician, but it's hard for them to sometimes get into the pediatrician when they're sick, and we don't want them to have to go to a walk-in clinic and wait 4 hours, which sometimes it's like that. Sometimes it's not. So we are an option that they can come see us. Yeah.
Speaking of walking in sick, how is your experience going with the past 2.5 years with COVID, and what that's looking like now? Like, do you guys see a lot of patients coming in with COVID symptoms? Do you do the COVID test? Like, what does that look like for you guys?
We have seen patients. We're both very comfortable when it comes to treating patients with COVID symptoms, COVID, any kind of upper respiratory, infection, because COVID is viral. It's not bacterial, right? So yeah, we're comfortable with seeing those types of patients. We do offer COVID testing, flu testing, as well as other testing if need be.
Yeah. So whenever a patient comes in that might have COVID, do you guys like get in hazmat suits?
No.
No, we
Stop.
if they call and we are told, hey, have a cough or whatever, something that we think is COVID, we may ask them to wait in their car because we do have a lot of well people, and then we'll bring them straight into a room to kind of minimize the exposure. But there is more COVID cases in the last month or so, I would say. Not as bad as last year. And the cases are more mild now. We are not seeing as many hospitalizations and deaths in my experience. So it's not as scary, but you still have to be causous.
Yeah.
Okay.
I know you guys are not epidemiologists. Is that the right term?
Yeah.
Or but
Or infectious disease.
yeah. So from the little reading and YouTubing and all this stuff that I've done, of course that is to be taken with a grain of salt. Is it true to say that when a viral infection mutates, that on average the mutation is less, the strength of it is diluted for whatever reason?
Historically, that is usually true.
So like for COVID, whenever the Delta variant came out and all this stuff, I mean, you would think like since we've seen less and less hospitalizations that the variants are usually less severe. Is that kind of the trend?
Like she said, historically,
It's true. Usually they should be less severe, mild symptoms, but
I mean,
there's
everybody's
so much
different.
we don't know about.
Yeah.
Like COVID is an unpredictable autoimmune response. Everyone's going to react differently. So when I had COVID last year, I had healthy, really no medical problems. I had double pneumonia. Everyone's unpredictable.
she was really sick for like a month, and then I got COVID in February, and it was a completely different experience because she likely had Delta. I likely had Omicron. Now I was sick, but not dropping my oxygen like her and her husband were. But fever, like a significant fever, and feeling like I had the flu. So, but could it mutate and be worse? I mean, it's possible.
I think it's still being studied. I still think there's a lot of unknown when it comes to COVID. It's still pretty new.
Yeah.
This is year 3 now.
Yeah.
Yeah, and then now we have monkeypox.
Oh God.
Like crazy. Like I feel like what's next? I mean, geez.
Okay.
And then from what I understand, monkeypox is targeting a very specific demographic. So I don't know. I don't know how that's going to come about. I don't know if that's a real threat at the moment. Nobody thought that COVID would be a real threat either until the first case entered the U.S. and then all of a sudden, all 50 states had it. We're like, crap, that was fast.
Yeah.
Yeah.
It was like a tidal
man.
wave.
Yeah. All right. So we talked about the differences between your practice and other primary care offices. What are some of the services? And I think some of you mentioned it already, but what is some of the services that people should expect and should take advantage of at your office?
Okay, so we also offer allergy testing and allergy drops. And if you don't want the allergy shots, we can do the allergy drops, which are just as effective in treating.
Is that like a dose of
symptoms.
Benadryl?
No.
No.
No, this is trying to eliminate your allergies, not just treat the symptoms of them. So it's immunotherapy drops where you're exposed a little bit at a time to the things you're allergic to kind of desensitize your body to those allergens. It is a long-term therapy.
About 3 to 5 years, depending how you tolerate and how you do on them.
Yeah.
So you do you do like the allergy panels where you like have you have those little
Not
pricks
the
on the
prick
back?
test. We do
No,
blood work
it's
for
blood
it.
test.
Okay, you do
Yeah.
blood work.
Yeah.
Okay, is that pretty much the same thing? Can you guys find different allergens just through the blood work?
Yes, for
Okay.
sure.
What's the most popular allergen in this area?
Oh, we have a huge panel of allergens.
Most
like
popular would be like the trees
oak,
and
yeah.
trees and grasses and
Okay, yeah.
dust
Yeah.
mites.
Okay.
Oh, everyone's allergic to dust mites.
And I used to think that I wasn't allergic to anything. Now I'm starting to think like maybe I've developed an allergy to like certain maybe pollen because I'm starting to find like certain times of the year I feel like I sneeze a little bit
Yeah.
more and I'm like, And now I'm starting to like look at Claritin. Like I've never taken like Claritin when I was younger. And I'm looking at Claritin like,
Yeah.
give me that Claritin pill,
Yeah.
like that chewable.
Grass pollen is pretty high right now, so if you're feeling it this past week, it's probably because of that.
Yeah, maybe not so bad this past week. Earlier than the month, I went and bought. It was like past couple months. I went and bought a little squeeze bottle of nasal spray, and I'm like, and my nose felt like there was pressure. And I'm like, I don't know what it is, but as long as it doesn't turn out to be anything. And then I ended up catching a mild little cold for the week, and I didn't go get COVID testing because I was like, I don't know if that's it, but I'm just staying home for the most part. And then we had a beach trip, and I was like, please don't let me be sick for the beach trip. But thankfully, I got it out of the way, because I find that I get sick a lot of times during the early summer. Like, I don't know why. It just happens. And, I was like, please don't be sick on the beach.
Probably allergies.
Yeah. And, I'll probably have to get an allergy panel, too.
Maybe.
Jeez.
Maybe. We also offer Botox.
Okay.
That's
different.
Males and females. It's not just for the women. We offer a weight loss, like we talked about earlier.
Options.
Yep. Various weight loss options, prescription and non-prescription. And we do the wellness and the sick visits.
So Botox, so like that's like estheticians type stuff.
Estheticians usually
they do more like facials and stuff
like
that.
Yeah.
Botox, usually they don't.
No.
It has to be by a licensed professional.
Okay,
They're like
maybe
an RN or a nurse practitioner or physician.
You have to go to a and get a certification in it.
Okay. Maybe I'm thinking that I always thought estheticians could do that. I mean, unless they're licensed, I don't know.
Yeah, they could do laser treatments, I think.
Yeah.
And facials for sure.
So Botox, I mean, from what I understand, and Botox has been around for a long time, that's just simply an injection that numbs or temporarily disables a muscle, correct?
Relaxes your muscles.
Yeah. And so, like, do people get those in their lips?
Yeah.
They can.
Or is it like lip filler? Is that not the same as Botox?
It's usually filler in the lips if they want it to enhance their lips.
Yeah.
But sometimes you can do what we call a lip flip with Botox to kind of, I guess.
Is that shooting it underneath the lip and then like pushes it up?
Well, you kind of relax these muscles here.
Yeah.
And it kind of makes it go out just a little bit, not too.
It's not drastic.
Yeah.
So if you want.
It's very subtle.
You need filler.
No, I've seen some people that over enhance.
Yeah.
And like, dude, your lip is flipping over itself.
With Botox, it's more like, the forehead, the frown lines, and then the crow's feet.
And is it common for people to try to smile or laugh and not have too much of an expression? Like their forehead doesn't move that much?
Well,
like, because I have this thing right here.
Yeah, I do Botox, and I had a big crater there, but after so many treatments,
I can't even tell that it's even there. Yeah, wow. Because I got obvious little lines.
Mine was probably about like yours, but mine was just one line. So.
Oh wow. Okay.
It's amazing what Botox can do.
Some people come in and they're like, "Yes, I want to be frozen."
Yeah, we have that talk with them. I really like the natural look.
Yeah.
But.
We
have the discussion.
Yeah. I mean, and that's awesome because sometimes you can tell when somebody's had Botox, like something's different. Like something looks. Now the lip filler that's obviously something a little bit different. I've seen some people who I'm friends with who've had lip fillers, and this one particular person, I won't mention any names, but it looks great on them, and they do it just right. And there's their facility on Ambassador that is specialized in this, and it looks great. And now she does look slightly different from whenever I've known this person, but I mean, she just felt like that's what she had to do for herself to improve her image on her and like in her head and outwardly. So it looks great.
I mean, we are trained in filler, so we can do it. We just choose not. We don't want to cast our apron too far.
Yeah,
we chose not to do that. But so we send a lot of our patients down to a friend of ours, Serenity Spa on Shenandoah.
Oh yeah, right there in Youngsville.
Yeah, they do a fantastic job with lip filler.
Awesome.
Leilani and Christy over there, the nurse practitioners.
Hey guys.
All right, so I think we've covered most of the bases of what you guys do, why you guys do it, and the differences between the different types of care. Ultimately, like, what would people need to do to connect with you guys to kind of get something set up? Obviously, probably just go to your website, But would it be better for someone to just call and to schedule an appointment, or like what would that look like?
I mean, they can do either. They can go to www.cypresshealthclinic.com. They can book an appointment with Jaimie or myself, or they can call 337-450-3047 to talk to Katie to schedule an appointment and verify insurance.
Oh, you got to do the insurance verification first.
Yeah.
Oh, Lord.
We take cash patients too. So
Well, of course they do. Like nobody. Well, oh, you're paying in cash. I'm sorry.
well, a lot of people don't have insurance, and so they have a lot of fear about what my bill's going to be. So we try to help out the people with no insurance. So we have relatively competitive prices.
And affordable health care.
Yeah.
All right, so that's good because I mean, yeah, some people don't have insurance for whatever reason. I feel like now it's almost like car insurance. Like most people should have it. Like,
yeah, but there are still a lot.
Why
of
are
people.
you walking around without your insurance?
Yeah.
A lot of people think, well, I'm young, I'm healthy, but hey, you never know. You really never know.
Yeah, and it's like I know Aflac is not the same as what do they call that?
Major
medical. Yeah, that's the term. And I look at like this was 10 years ago. I was looking at Aflac like, oh God, like. I was like, I'll just pick everything. And they say, you can't pick everything because then that's defeating the purpose.
Yeah.
Right.
And they're like, you could either choose cancer, you can choose heart attack coverage. I'm like,
hospital coverage.
yeah. And I'm sitting there thinking to myself, like, how am I supposed to process this? I'm looking at like, okay, I don't want to think that, oh, heart attack. Like, let me get that because I don't want to think that I'm going to have a heart attack.
Right.
Nobody wants to think about that. And then, like, cancer, the big C word, I don't want to look at that.
Right.
It's
so,
scary.
like, yeah, like, how do you be like, oh, chances are this is it. This is the one. Like, I don't know. That's weird. So, I wish medical was a little bit more
cut and dry.
Yeah. I wish
Me
the
too.
medical industry as a whole was a little bit more just like simpler. It's a little too much, but
We wish it was too. Trust
Right,
me. It's
I'm
hard for
sure.
us. The insurance companies are not easy for us to deal with just as
No.
much as it is for y'all.
yeah. Okay. So, what advice would you give someone that is apprehensive about calling a nurse practitioner office or a primary care office? What advice would you give them to kind of help them kind of breathe and be okay with booking an appointment? Let's just say for me, I'm almost talking to myself here.
Okay.
To book a wellness check, like how would you ease someone into doing that without having these weird like anxiety kind of field thoughts?
Everybody should get a wellness because preventative medicine is super important.
Yeah.
If you don't know you have a problem, you can't fix that problem. Everybody gets nervous. We're human beings too. So let me tell you, there's nothing you can tell or show us or anything that we haven't seen. Remember, we worked in the emergency room before.
Yeah.
So we've seen a lot. We're not going to judge or treat you any differently, but we're here to help. Genuinely, we want to help people. So
What I tell my patients, look, I'm here I'm here for you. I'm here to help. Just tell me what's going on with you today. We can just have a conversation that doesn't have to really lead to anything except maybe some blood work.
Okay.
So
Wow. All right. Okay. Well, hopefully that helps somebody. I know that I need to get a wellness check, and I realize that, and it's obvious. I have people telling me in the comments that I need to book an appointment. God, thanks, Brittany.
and if something is out of our scope of practice, we refer.
Yeah.
Of course,
Okay,
that would
yeah.
be the appropriate thing to
Right.
do.
As a
So-
professional, yes, that is appreciated. I think we had a couple more comments, and then I think we'll wrap it up. It's 48 minutes. You made it, Kim.
Wow.
You thought you wouldn't be able to fill a conversation for 45 minutes, and you've made it.
Thanks, Tim.
See, I told you it wouldn't be that bad. All right, so got a couple comments. I'm going to read those off, and then if there's anything else that we need to mention, we will. All right, so Alicia Malonzo, I'm pretty sure you...
Yeah.
I mean, all the Malonzos are coming out right here. Okay, so Alicia says, we love a woman-owned and operated local business with healthcare professionals you can love and trust, the best two nurses I know. All
Thanks,
right.
girl.
Sweet.
Yeah.
And then we have, looks like Michael Guidry.
Oh, that's
did
my
make
husband.
There you go. Wow. Got the
Mike.
support coming out. All right. An amazing clinic, homey environment with staff that truly cares for patients. Like my vision, I was looking at homey and it didn't look like homey at that moment. Okay. If
So you need
could
an eye exam too.
look, I think my vision's
dry eye,
okay.
tune-up.
Yeah. My wife's vision, hers went down real quick in her 20s. Now she has contacts and glasses. I still see pretty clearly for now. And you know what? Vision is weird. Like she didn't know that she was going blind roughly until she tried on a pair of glasses that was fitted for her. And like, she was like, I didn't realize it was this bad.
We do throw in just a basic visual acuity in our wellness to kind of check and make sure, because some people aren't aware.
Good to know. Good to know. Because I find myself
part of your wellness.
Yeah.
awesome. Because I find myself while I'm driving, I'll look at street signs and I'm like, can I still read that from this distance? I'm like, it's a little bit.
Yeah.
I'm getting there.
Yeah.
All right. We had another comment. I think it's Alicia again. Or did she accidentally put? No, it's a different comment, but she wanted to write it again. All right. Two of the best nurse practitioners I know, also love seeing a local woman-owned business. So she wanted to reiterate that. Awesome. Well, is there anything that we did not cover? I think we covered most of the bases, but if there's anything that you guys want to plug or make sure to reiterate and confirm, now is the time to do it.
We do, like we said, we're open Monday through Friday. Monday through Thursday, we're open from 7:30 to 5:30. Fridays, we're open 7:30 to 1:30.
But we're closed today.
We close today to come do this just with you. We do same day appointments. We try to keep slots for people who are sick, or even wellness is last minute. I'm going to do it.
Okay.
So,
all right.
Yeah, we're very accommodating.
Yeah.
You
So
know.
That's good to know, man. All right, because that's been one thing. Is like every doctor office that my wife calls for my little boy, or if it's a dentist appointment, like they're months out, like months, and like, dang, like, what if you need help? You gotta wait a few months.
Yeah.
What if you need it right now?
No.
Like, obviously there is an emergency room, but
the urgent cares, but that's kind of what we're trying to. You used to go to your doctor for when you were sick and all that. And now we have the urgent cares because the primaries are so booked up with health maintenance. Right. So we're trying to kind of do both.
Yeah.
You know.
Okay. Well, I want to show the website for you guys while I have you guys still here. So this is the website. It's cypresshealthclinic.com. And you can just kind of browse their website, check them out. You can actually see a nice photo of Jaimie and Kim there, and you can just read about them. You can read why choose them, and then how to get started. Obviously, the first thing is to schedule an appointment, because you can't get started beyond that. And then they show the different insurance plans that they will accept. And then of course, their hours and the address and their phone number and email, all the good stuff. And then they have a whole, I say a whole about is the same page. I just clicked it and it scrolled down. So yeah, you can read everything you need on their website. And it looks like it's a great looking website. It's very Bayou themed with the whole Cypress feel. Yeah, makes sense.
Thank you, Michelle Ashcraft, who's our designer. Also my BFF.
Yeah.
Sweet. All right. Well, look, I think we had a good talk here. I think you overcome your nervousness there, Kim. And Jaimie, she seemed pretty rock solid the whole time.
I was nervous, though.
Yeah.
She's very good. I'm more expressive.
Oh yeah, she was holding it down, and she was like, "Kim, get it together."
No, like I said, I'm the quiet, nervous one. She's the talker, nervous one. Yeah. You know.
Yeah. All right.
I forgot to say, we do joint injections too. So
joint injections.
Joint injections. Yeah.
So let's say, for instance, you have really bad
knee arthritis, shoulder arthritis.
Is that when your knees pop, or is that something else?
Can be if they hurt, you know.
Well, they don't hurt. They just make sounds whenever I get up.
They're probably getting there.
We'll have to x-ray you then.
No. No, don't fill my head with more thoughts.
Like I have a lot of people who have knee arthritis, knee pain, shoulders, elbows, ankles, whatever. But knees is the most common. And
You don't want surgery, just
they've been told the only option they have is surgery, and so There are shots out there. We can do steroid shots, but there are injections called hyaluronic acid injections, which you see the face creams for hyaluronic acid. But what it is a cushioning agent and lubricating agent to the joint for the knees that allows you to kind of help increase the space in your knees so that they can be less painful and you don't have to have surgery or prolonged surgery for when you're ready for it. So I've had a lot of patients who, for my mom, for example, and she wouldn't mind me saying this, but she's had partial knee replacement on one side and they told her she needed knee replacement on the other side. And she said, absolutely not. So we started doing those shots about, 7-8 years ago. And I've done them 2 or 3 times. And she's like, this knee feels so much better than even my knee replacement knee. I wish I never would have had surgery. I would have just done these shots if I knew that was an option. But a lot of surgeons, they give that option, but they don't give that option, I mean, there's a place for surgery, trust me. But if we can prolong that or even avoid it, that's something we can help out with too.
For people.
Yeah.
So
this spring, I thought we were almost done,
Sorry,
but
no,
it's good.
That.
It's good because you know what? Sometimes I'm like, I feel like there's more that we can say. Okay, Brittany just left another comment. Thank you, Brittany. She says you have a list of things, Ben. Thank you for that.
We can chip away at your list.
Yeah.
Okay, so I'm gonna add another one to the list here.
Okay.
Is there an issue, speaking of joints here, with that?
Cracking them?
Cracking your knuckles.
So my previous job was at a chiropractic office, and they would probably tell you not to they call it self-adjust. Like people crack their neck. I'm guilty. Back, all that stuff. Because the adjustment is not specified to what is actually out of alignment. Typically when you do it yourself, you don't know what you're adjusting. Now your fingers, it's probably fine, but like your neck or people that crack their back or I'm always popping my elbows and I'm not supposed to do that. No. But no, the old adage that your knuckle's going to get bigger if you keep popping them. No, I don't typically see that, but you should not adjust your neck.
My mama, I call her my mama because that's how I've known her. She did pass away in 2006, but I remember as a teenager, I would pop my fingers often, and like I could pop them all kind of ways, even twisting them and like, just all that stuff. And she would always tell me, "You need to stop doing that." I'm like, "Why?" It feels good. Like I just like the way it feels. I don't know. She goes, "Your knuckles are gonna get bigger and they're gonna look swollen, and you're barely gonna be able to move your hands." I'm like, "Okay." It doesn't look like it's doing that.
Now, if you with wives,
if you do it enough, I mean, in theory, you could cause some joint inflammation and make them swell. But I mean, that would be like repetitive over and over again.
Bruh. I mean, mine's pretty repetitive, but like I used to crack my back in high school whenever we had these very specific desk. And if you are the same age as I am, you may know of the it's the wooden top with the blue plastic chair.
Yeah.
And I would lean and the plastic chair would give a little bit and it was just at the right height where you push back and it's just like, and it felt so good. I have not cracked my back probably since high school. I'm scared to even think about doing it. Because first of all, my muscles are a little tenser now and all that good stuff. We did get a new mattress recently, so I'm feeling a lot better with that. But
that always helps.
Yeah.
And a good pillow. Same.
And a good pillow.
And a good pillow. Yes. We also got new pillows. Like the mattress came with pillows, and they're like memory foam kind of. So
nice.
It's really nice. Anyway, it's not a mattress commercial, but I used to do the back cracking. I still do the neck cracking, and I know it's not the best, but I've been doing it for so long. Yeah. So it's like I'm tempted to want to do it right now. Like I really feel like I need to.
Yeah.
And my wife, of course, she found a YouTube video or a TikTok video, one of the two, and it was a guy who apparently cracked his neck. Okay, because he would crack his neck on a routine basis. That's what he would always do. But one day, and I'm about to scare a lot of people here. If you're listening, you're probably like, "What's he about to say?" This guy cracked his neck one day and had to be rushed to the emergency room. He dislodged a blood clot somehow in his neck, or through doing that that got into his brain. I'm like, Kelly, I did not need to hear this.
In theory, that could happen, yes.
Bro.
So he probably had other stuff going
He probably
on,
had plaques in
underlying
his
issues.
carotid.
Yeah.
God. Okay.
I mean, if you have a really bad disc, I mean, you could inflame it,
yeah.
slip it, technically.
Yeah.
It would take a lot of force, but
Yeah. Have you ever been to Sky Zone?
When I was younger, probably like 10, 15 years ago.
Okay.
Or when it was Discovery Zone. I don't know what it was called back then.
It was Discovery Zone, but Sky Zone's relatively new. It's in the
Okay.
past 10 years. You're talking about joints and feeling old and all that good stuff. And look, I swear after this, we're done. We're done. Because I could tell people are like, I don't want to hear about his knuckle cracking. Okay. So Sky Zone has a foam pit. And we went for a birthday party one Saturday. And I was like, okay, I love jumping on a trampoline.
Yeah.
And I know as you get older, that tends to be a little bit more problematic if you don't jump right. But, we were having fun, and they had this one foam pit that looked so enticing to jump into. And I was like, okay, I really want to do it, but like I'm apprehensive because what it was, okay, so you have your foam pit, and they had this almost like a diving board. You had to crawl up this like airfield, like it's like a inflatable type diving board, and you get to the top, and you're estimated to be about 7 feet above the foam pit bottom. Okay. And I was scared, but I said, you know what? It's a foam pit. How bad could it be?
Right.
Well, then one of our family members, a guy just a little bit younger than myself, and he's also in his 30s, just got into his 30s, young guy, me being 36 over here. He jumped into the foam pit, and he was fine. Mm-hmm. So I said, cool. It looks fine. I'm going to jump into it. So I go up this ladder, this diving board situation, and I get to the top, and I'm looking down. I'm like, it feels a lot higher than it looks. So I was like, God.
It's just then you realized you were afraid of heights.
Yeah, it was at that moment that I knew I effed up. And I'm like, okay. And then I have my wife, if she's listening, she's gonna be like, why did he have to bring that up? Everybody, including my wife, was like, dude, just jump. Yeah. It's not that bad. And they were looking at it from their perspective. Right, yeah. And I'm like, okay. And then it didn't help. I had Sky Zone employees going, yeah, bro, we've done it so many times. It's fine. Just do it.
Egging you on.
Yeah. And there's no instructions on like the best practices to jump off of this diving board, into this foam pit.
You should land this way. No.
Right. I think they should tell you, like, hey, avoid this particular style of jumping.
Yes.
Because I think I might be the poster child of what not to do. Okay.
What did you do?
I did what I felt was natural. I cannonballed.
Oh, no.
And let me tell you, worst decision of my life.
Straight through to the bottom.
Oh, God. Oh. It felt like I hit rock bottom.
Yeah.
And I don't think I actually did hit rock bottom, but what I think happened is that I came down with such momentum, especially with the cannonball situation, and my tailbone was the first thing to enter into the foam pit.
Yeah.
And I did foam, cannonball. I tucked and everything, and whenever I landed, I must have compressed all of the foam to where there was no more give that it could give. Mm-hmm. And it just went into my back. Oh, yeah. And instantly could not move. I was frozen. All the muscles in my body were tensing up, and I started sweating, like just drenching. And it was not hot in there. It was cold in that building. And I just started sweating. I could feel the foam pits, like the foam pit blocks were starting to dampen up. I'm like, wow, oh God, this is bad. And like, you could tell, like, everybody's look on their face was like, oh, something's wrong. I'm like, I'm freaking out, and I could barely breathe. I felt like I had the wind knocked out of me. And I had, of course, Sky Zone staff rushed to me and like asked if I was okay. I said, I need water, because all the water in my body is gone out. Like, I don't know why. and so me thinking I'm paralyzed, like, and I thought I heard like a click whenever I landed too, but maybe just my back popped, and I was freaking out. And so I moved my toes, and I'm like, okay, I can move my feet. I'm not paralyzed, at least from what I can tell. And I was in there for probably about what felt like a good 5 minutes, but it felt like an eternity. And then I look up at the diving board and I have these like 3 and 4, 5-year-olds screaming, "Move, old man." They were like, "Move, we want to jump." I'm like, "I can't." Like breathing hard and sweating. And I was like, dude. And then my wife said, "Are you okay? Do we need to go to the hospital? Do I need to call an ambulance?" I'm like, "Please don't call an ambulance, not yet," because I knew that was going to be like a $3,000 or $4,000 bill. I was like, "Let me just see if I can get out." So I mustered the strength to get out, and it took everything I had to get out of that foam pit. Yeah. Foam pits by itself are hard to get out of without being hurt. Yeah. So I get out, and I couldn't stand up straight. Like it was hurting. I'm like, so I had
spasming.
Yeah, it was bad. And so I had to sit down and like still drenching. And of course I signed a waiver, okay, at Sky Zone, because you have to. Mm-hmm. My wife, they told her, and I'm going to incriminate, I guess, somebody, but I'm not mentioning any names. One of the staff members said, "Oh, don't worry about it." So she didn't sign a waiver. She's the one that didn't get hurt. I signed the waiver. I got hurt. I'm like, dude, just my luck. And sure enough, everybody in Sky Zone was like super attentive, and they were making sure to care for me. And then they said, "Hey, we just need to check, your waiver situation and all that good stuff." And he found the waiver. And as soon as the staff found the waiver, it felt as if Sky Zone just kind of went, "Bye." Yeah. I'm like, that's it. I'm on my own. And I suffered in pain. I even ate a slice of pizza for the birthday party, because the birthday party had just started. And I sat there in just agonizing pain. And, it took probably about 2 to 3 weeks for me to feel better. I even went to Cart Ranch probably a week or 2 after, and riding in a golf cart, I could feel it was still, there was some pressure in the spine. I said, I probably either compressed a disc or slipped something, but I said, you know what? From what I understand, backs can heal. You just can't do much, and it just takes a lot of time. Mm-hmm. So I stayed still. I stayed relatively immobile as much as I could, and ultimately it got better. But I think about that moment, and I'm like, and I passed by Sky Zone, and I'm like, nope. Like somebody's like, "Oh yeah, they having a birthday party at Sky Zone." I'm like, where? So yeah, anyway.
Well, if you're still having those issues, Ben, next week we can talk about an MRI.
There you go. Oh, okay. God.
That's your wellness appointment.
God. Look, you were just adding to the list. Thank you, Brittany, for making me realize that I have a list of things now oh God. Let's hope I go to this and everything is A-okay, and the only thing I need to do is like, I don't know, drink more water or something, even though I feel like I drink a lot of liquid already. All right. Well, this has now been an hour and 7 minutes, partly because of me being a chatty Cathy. Guys, I really appreciate you guys coming on.
Thanks for having us.
Thank you.
Yeah, I loved talking about the whole medical industry and kind of getting your part of what makes it good to use your practice as a nurse practitioner's owned business, and I love the fact that you guys chose Youngsville because it's more underserved than Lafayette area, and so
thank you, Ben.
Yeah,
thanks.
Thank you for coming on, and that is it, guys. Hopefully you have a great weekend.
You too. Happy 4th.
Yeah, happy 4th of July, and try to stay dry, or unless you're in
swimming. Stay hydrated.
Yes.
Stay hydrated.
Oh yeah, yes. Please
drink lots of water. Maybe a Gatorade Powerade here and there.
But yeah, I'm talking about dry also with the weather, because it's supposed to get rainy.
Oh, okay, that's what you meant.
Yes. Look, stay hydrated. Good advice. But I mean, we were in a drought what felt like for a few weeks there, and now we're pretty wet outside. Yeah. So anyway, that's it. Have a great weekend and happy 4th of July.
Thanks.
All right, y'all have a good one.
You too.